Hello and welcome back to my channel. So today we are going to be talking about some syndromes. Basically this is nerve compression syndromes. Let's start with the upper limb. So the first syndrome is carpal tunnel syndrome. Nerve compressed is the poor median nerve, and that leads to numbness, tingling, pain and weakness in the hand and fingers. So these are the regions that the median nerve supplies: the thumb, index and middle finger, and part of the ring finger, also the wrist and the hand. So who's the culprit here? The culprit is the transverse carpal ligament, possibly the tendons, because if you take a look at the carpal tunnel, you would see a lot of ligaments and a lot of some tendons as well going through there. Second is coming a little bit proximally. We have the cubital tunnel syndrome in the cubital fossa. The nerve is ulnar nerve, so poor ulnar nerve is going to get compressed here. Culprits are the ligaments or the fascia in the elbow, and it leads to tingling, numbness and pain in the forearm and hand, weakness in the grip as well. Now the ulnar nerve basically supplies the forearm, ring and the pinky finger, so that's where we are going to see the problems. Then the next one the last syndrome in the upper limb is pronator teres syndrome. Now again, pronator teres syndrome is a syndrome where the poor median nerve gets compressed. The culprit here is the pronator teres muscle. Symptoms are going to be pain in the forearm, numbness and tingling in the hand and fingers, similar to but often different from distribution of the carpal tunnel syndrome, because the median nerve, if you go a little bit higher than the hand in the forearm, it supplies the forearm, wrist and hands and finger, just like the median nerve distribution. But pronator teres syndrome is a little bit higher up in the forearm, whereas carpal tunnel syndrome starts from the hand, the wrist joint and below that. Now moving on to the lower limbs. So the first thing, let's talk about the very popular one, that's the piriformis syndrome. Piriformis muscle basically divides the greater sciatic foramen into two, suprapiriformis and infrapiriformis foramens. So now what happens is that in the infrapiriformis, basically below the piriform muscle, we have the sciatic nerve passing through. So who's going to be the victim here? Yes, that's right, the sciatic nerve. So the piriform muscle, which is the culprit, could compress the sciatic nerve. And this could be because of spasm, tightness, or any anatomical variations in the piriform muscle. Now, what happens if the sciatic nerve is compressed? There's going to be buttock pain, there's going to be sciatic-like pain, shooting and burning, and it's going to be radiating towards the that limb, lower limb. So numbness, tingling, pain, and it usually happens when sitting or sometimes walking upstairs as well. So sciatic nerve usually supplies the buttocks, the back of the thigh, the calf, and foot, typically on one side. So if the sciatic nerve is compressed, you would see the pain shooting through these areas. Next, in the lower limb, we have the tarsal tunnel syndrome. Now, the victim here is the poor tibial nerve, and the culprits are the ligaments or tissues in the ankle. This leads to the compression of tibial nerve in the tarsal tunnel syndrome, leads to burning, tingling, numbness, and pain in the sole of the foot and heel. So basically, the tibial nerve supplies these areas, the heel and the sole of the foot, so you would see burning, tingling, numbness, and pain in these regions. The last syndrome that we're going to talk about is the neuralgia paresthetica. This is also in the lower limb, neuralgia paresthetica. Here, the victim is the poor lateral femoral cutaneous nerve. The culprits are the ligaments, fascia in the thigh, or the pelvic region. So femoral nerve, just remember that just below the inguinal ligament, we see the femoral nerve, right? So that's where it can get compressed. And the lateral femoral cutaneous nerve of thigh, if that is compressed, then there's going to be pain, burning, numbness in the outer thigh. And that's the region, the outer and lateral thigh is the region that is supplied by the lateral cutaneous femoral nerve. So when that is compressed, the problem is called neuralgia paresthetica. That's all for today. I hope you liked it. Thank you so much.